I think that's the most difficult one. I mean, what does it mean to be a professional?
Well, being a professional, in my mind, is like the umbrella of everything we've discussed before. Because a professional is informed, a professional can communicate, a professional has values and has a code of practice, a code of ethics that guides them. They have to be trustworthy, they have to be honest, they have to have integrity, they have, all those values that we espouse in our day-to-day life, in addition to being accountable, to serve, to the profession and to the people that we serve. So professionalism is really a broad thing, but it is that doing what is right for self and for the common good, and practicing within the bounds of the code of ethics as internationally internationally understood and appreciated and desired.
Professional, it is a level that through acquired knowledge and skills, you still add attitudes that makes you a professional that applies the rules of the art of healing. Not only maybe making good diagnosis, giving good treatment, but also behavioral professionalism towards patients, towards your colleagues, and in respect of laws and also ethical conduct.
But when we talk about being a professional, we often do the opposite, and we describe unprofessional behaviours. We say, oh, that person behaved unprofessionally, or that wasn't terribly professional, was it? I don't think that's good enough to say that. I think we need to say that was unprofessional because of, or I don't think that was quite what we expect from a professional because the behaviour was such, or the behaviour wasn't this particular behaviour. So, and a lot of professionalism is about behaviours. A lot of the ways in which we describe being a professional is about describing a set of behaviours. It's about values and a set of attitudes. So if somebody is dismissive or rude to a patient, we would say they're unprofessional. If somebody shouts at a colleague in public, in a hospital, we would say that was unprofessional. If somebody leaves their duty early without informing or handing over their patient care or completing a particular procedure, we would say that is unprofessional. And we now have professional regulatory bodies and professional codes of conduct that enshrine those behaviours and those attitudes and have sanctions on people if they behave in that way. I think let's consider what it means to be a professional by asking the question, what is a good doctor good at, for instance? A good doctor is good at communicating well. A good doctor is hygienic and clean and respects infection control. So we can begin to describe those things. And it's very important for medical students early on in their training to begin with their peers and with their teachers to articulate what professional behaviour means at the level that they're at, but also what it means in the future as they project themselves as doctors and as specialists.
That is somebody who thinks about getting things done at the right time, for the right people, and for the right reason.